Hello everyone, I am Beatrice. In today's video, we will look at antacids. Antacids are medication that people can get easily from over the counter, but without knowing that it comes with its own complication if not properly used. And this medication also interacts with a lot of medication. So the knowledge of this medication is very important. Before the end of this video, we'll look at some NCLEX style questions that will test your knowledge on this topic. So if you are ready for today's video, let's begin. So what are antacids? Antacids are alkaline substances, or in other words, we say they are base that are given to neutralize stomach acid. We know that the stomach itself secretes hydrochloric acid, either before you eat in anticipation for food, so that it can digest the food and also destroy bacteria, or even while you've eaten, it's also secreted more to help in proper digestion of food. But at times, when a patient have issue with maybe gastroesophageal reflux disease, heartburn, peptic ulcer disease, so when hydrochloric acid is secreted, it comes in contact with some of those things in the stomach, like if there's the presence of ulcer, like peptic ulcer disease. I looked at that in one of my videos. So with antacid, it's able to neutralize that acid and reduce the effect of that acid on the stomach so that it can prevent or reduce that pain that comes with peptic ulcer disease or those discomfort that come with GERD and indigestion and heartburn. So in other words, the mode of action of antacid is to increase the gastric pH to neutralize that hydrochloric acid in the stomach. Now there are four types of antacids you need to know. It's either magnesium hydroxide, or what we call milk of magnesia. We also have aluminium hydroxide. There is calcium carbonate, that's the popular one terms, and we have sodium bicarbonate. We'll look at each of these antacids one by one and look at some things we need to take note of. First, let's look at magnesium hydroxide, milk of magnesia. A major side effect is diarrhea. That's from the mode of action. It promotes intestinal motility, so it promotes bowel movement. Another thing you need to know about magnesium hydroxide is that it is contraindicated in intestinal obstruction, appendicitis, even anything that has to do with abdominal pain that has not yet been diagnosed. That's because of that mode of action of magnesium in increasing intestinal motility. If a patient has intestinal obstruction, we put the patient on nothing by mouth and observe to see what's happening. And we want to try as much as possible to not stimulate that bowel. So if a patient takes magnesium hydroxide or compound containing magnesium, it cannot promote bowel movement. And because we don't know what is causing that obstruction, it can cause other problems. So if given in any of these situations, it can cause increased pressure and the patient stand the risk of peritonitis, perforation because of that pressure. And also for undiagnosed abdominal pain, it can mask symptoms. And also due to that increased motility, for a patient that has appendicitis, with that pressure, it can cause rupture of the appendix. The next one is aluminum hydroxide. A major side effect is constipation. Even calcium also causes constipation. So what another thing you need to know about aluminum hydroxide is that it acts as a phosphate binder. So when given to patients, it binds to phosphate and promote the excretion of that phosphate in feces. So in other words, it's used in treating hyperphosphatemia. And the implication of that is that if a patient takes too much of aluminum hydroxide, the patient stands the risk of having an electrolyte imbalance we call hypophosphatemia. Then you need to also know that aluminum hydroxide reacts with some medication, especially medication like tetracycline, warfarin, and digoxin. And aluminum compound contains sodium, so it should be used cautiously in patients that are hypertensive. The next one is calcium carbonate, which is TUMS. Major side effects include one, constipation. So I don't forget this because of C for constipation, C for calcium. So just like aluminum, it causes constipation. The another side effect is kidney stone. In fact, about 75 to 80% of renal calculi, that's kidney stone, is caused by calcium. So when taken in excess. Then calcium can also cause what we call rebound hyperacidity. That is when you stop taking this calcium carbonate, it can cause a rebound secretion, like hyper secretion of stomach acid. So to now worsen the whole symptoms, which was the main reason for taking the antacid in the first place. So you need to know that it can cause this. Another thing you need to know about calcium carbonate is that it can cause what we call milk alkaline syndrome. So this is caused by excessive intake of calcium, leading to three major things, which are hypercalcemia, metabolic alkalosis, and renal injury. Some of the signs and symptoms of milk alkaline syndrome include headache, fatigue, urinary frequency, anorexia, nausea. So you need to teach patients that are taking calcium carbonate to reduce or totally avoid the intake of vitamin D because it can increase the absorption of more calcium into the body, causing hypercalcemia. And another source of calcium is from milk. So they should also not take too much of milk products when they are taking calcium carbonate to reduce that risk of having too much calcium in the body. And then finally, about calcium, it causes other side effects like flatulence, bloating, belching, and that's because calcium carbonate reacts with stomach acid to produce carbon dioxide. Then finally, we have sodium bicarbonate. So sodium bicarbonate, the major side effect include fluid retention. That's because of sodium. You know, sodium pulls water along, causing retention of fluids. So it can cause fluid retention, and that means the patient um, is at risk of developing hypertension. So because of that, we don't give it to patients that have heart failure because they're already retaining fluids. We don't give it to patients that are hypertensive because of that risk of fluid retention and risk of increased blood pressure. And sodium bicarbonate can also cause that bloating and metabolic alkalosis. Now, let's look at some complications with antacid use. When you use antacid for a prolonged period of time or you use it excessively, we have electrolyte imbalances. I've mentioned some of them like hypermagnesemia. Of course, when you take any magnesium product that is in excess, it can cause hypermagnesemia. Hypercalcemia, when you take calcium compound, it can cause it when it's in excess. And then hypophosphatemia, that is from aluminium compound acting as a phosphate binder, promoting excretion of phosphate in feces. And then metabolic alkalosis, we know that antacid is a base. So when given or taken in excess, it's going to affect the pH. It will increase the pH, leading to metabolic alkalosis. Then drug interaction. So antacid interacts with a lot of medication. I've mentioned some of them before. It also interacts with medication like iron. It decreases the absorption of iron, fluoroquinolone, which is an antibiotic. It also interacts with levothyroxine, digoxin, tetracycline. So it interacts with a lot of medication. So because of this, whenever patient is on antacid, we usually teach them to take it 1 or 2 hours before or after any other medication. We don't give antacid with most medication because of that interaction risk. And then I've mentioned before rebound hyperacidity, especially calcium and sodium antacid can cause rebound hyperacidity. Patient teaching, we teach patients on antacid to wait 1 or 2 hours between antacid and other drugs because of that risk of interaction. It interacts with a lot of medications. And then we tell them to avoid the long-term use without their healthcare provider advice. So if there's no advice to continue using antacid, it should be just for relieving that discomfort or that pain that comes with ulcer or GERD or that discomfort generally. And then the patient should monitor for signs of electrolyte imbalance. So if they are having some symptom that doesn't go well with them, they should report immediately to their healthcare provider because it could be that they are having some electrolyte imbalances without knowing. So now let's review some NCLEX type questions that will test your knowledge on antacids. The first question: a nurse is reviewing discharge instruction for a client taking aluminum hydroxide as an antacid. Which statement by the client indicate a need for further teaching? A. I will take the antacid after meals to help with acid control. B. If I get constipated, I will try a stool softener. C. I can take my iron pills at the same time as my antacids. D. I will tell my doctor about all the medication I take regularly. The best answer will be C. I can take my iron pills at the same time as my antacid. So that shows that this patient does not understand properly. The patient needs further teaching because we know that antacid decreases absorption of iron. So it shouldn't be taken at the same time with iron. A client is prescribed an antacid for frequent heartburn and also takes several daily medication. What instructions should the nurse provide? A. Take all your medication at the same time daily. B. Take your antacid with food and other medications to reduce stomach upset. C. Take your antacid at least 1 to 2 hours before or after other medications. D. Antacid don't interfere with most medications, so timing doesn't matter. The best answer will be C. Take your antacid at least 1 to 2 hours before or after other medication. and that's to prevent risk of interaction. Which best describe the action of antacids? A. They reduce acid secretion by blocking histamine receptors. B. They form a protective barrier over gastric ulcer. C. They inhibit the proton pump in parietal cells. D. They neutralize existing gastric acid in the stomach. The best answer will be D. They neutralize existing gastric acid in the stomach. Which side effect is most associated with magnesium containing antacids? A. Constipation. B. Black stools. C. Diarrhea. D. Hyperglycemia. The best answer will be diarrhea. So that wraps us today's topic on antacids. If you find this video helpful, please like, share, leave your comment, and subscribe for more educational videos. Thanks for watching.